Get ready for Benjamin Knight Fuchs live. Live on LinkedIn, YouTube, the interweb. Ben, how
Good,
are you?
Liam. It's not get ready for Benjamin Knight Fuchs. Get ready for Liam and Benjamin Knight Fuchs. Doing this
Liam
together.
and Ben.
We're looking a little black, though.
That's right.
I should probably have some more color here.
Hey,
I like black, though.
black. Where it's
I'm fond of
at,
black.
I do too.
Yeah, black. Black
Me
is
too.
all colors. Did you know that? White is no colors. Black is all colors. All colors are brutal.
Black is
all colors, and black is beautiful. So today we're going to talk about red.
Black is beautiful.
What's that?
Black is beautiful.
Today we're going to talk about red. And in Latin, red is rosacea, rosy. Rosacea is one of those skin conditions that people don't really know what to do with. You know why? Because it's not really a skin condition. And that's really kind of an interesting idea, is that just because something's on the skin doesn't make it necessarily a skin problem. It looks like it's a skin problem because we can see it, but really with rosacea, you're dealing with a blood issue. The reason it's red, rosacea, is because it involves the blood. It involves the circulatory system. And rule of thumb, anytime you have what's called vasodilation, blood vessels opening up, so you get redness, you have an immune reaction. This is one of the ways that one of the mechanisms that the body uses for delivering or getting immune cells to a particular area. It'll open up the blood vessels so that the immune cells have access to the area. Basically, when you have some kind of allergic reaction, immune reaction, something that has alerted the defense system, the body's way of getting defensive or immune cells to that area is through the blood. So the blood vessels will open up so you get more access. And that's why redness is always associated with immunity. Whenever you have redness, you've got an immune reaction. That's rule of thumb. So right away, tell, and that is a rule of thumb, that if you have rosacea is when the face gets red right around, some people get it all over their face, mostly around the cheek area. You're dealing with an immune condition. So right away, you've got an immune problem, which is a defensive response. So anytime you have a defensive response, the appropriate question to ask is, what's the offending agent? If you go to skincare professionals or dermatologists, they're usually going to work on the outside, and they'll try to give you some kind of topical product, usually an antibiotic of some kind. There's some theories around mites, little tiny creatures that cause rosacea, because they found that when you have rosacea, people who have rosacea tend to have mites. But really, that can't be considered a cause of rosacea, because mites, the particular mites in question here, they're called Demodex mites, are everywhere. Everybody's got Demodex mites. So it's not like you automatically get rosacea symptoms when you have Demodex mites. The condition is in the blood. The blood is located deep inside the dermis, and it's very rare that you have contact problems. That is, where you put something on top of the skin, or something on top of the skin causes a reaction. It does happen, but for the most part, when you have a reaction that involves vasodilation, redness, you're dealing with something that's gotten into the system, which is why rosacea is associated with foods. And everybody who has rosacea knows when they drink coffee or drink alcohol or eat chocolate or certain foods, they'll break out, or not break out, but they'll get rosacea. Now, sometimes rosacea is also associated with acne and redness. And a sebum, oily secretions. This is true. So these are all part of the stress response. And the acne is usually a confounding variable in the sense that there's something else that's causing the acne. So rosacea, first and foremost, should always be considered a digestive or a food issue. There's a few other factors involved. So let's go to the first slide here. This is from Frontiers in Microbiology, role of the skin microbiota and the intestinal microbiome. That is the bacteria on the skin and the bacteria inside the intestine when it comes to rosacea. Let's see, what are the conclusion here? Need my magnifying glass to see some of these articles. Patients have been found to improve their skin conditions after oral consumption of probiotics, reestablishing gut bacteria, changes in gastrointestinal microecology, love that word, microecology, are often accompanied by the diagnosis of rosacea as well as psychological disorders, which is kind of interesting because there's also, slight digression here, there's also a relationship to mood and the gut microbiome, and people who have dysbiosis or problems with their gut microbiome are also prone towards anxiety and depression, which itself is linked to rosacea. Next slide. This is really interesting. Heliobacter pylori, or H. pylori, is a bacteria that lives in the intestine typically. But when it goes into the stomach, you can run into health challenges. In fact, ulcers are often caused by H. pylori infection in the stomach. And today, when you have an ulcer, stomach ulcer, you'll get antibiotic to kill the H. pylori. When I was started off in pharmacy school, they used to give you acid suppressants for ulcers. And that was discovered that ulcers, remember, I don't know if you remember this, Liam, back in the day, they used to say ulcers were caused by too much stomach acid. You know, everybody was on antacids for, do you remember when that was a thing? Right? No longer. Now
Absolutely.
you get an
Yes.
antibiotic because now they know it's H. pylori. And there's a funny story associated with that. These two scientists who were screaming from the top of their lungs, hey, there's a bacteria in the stomach that's doing it. It's not acid. It's this bacteria, H. pylori. Nobody would listen to them. So finally, you know what they did? They actually took a cup. Each of them took a big old cup of H. pylori bacteria, and they drank the bacteria. And they both ended up with severe ulcers. And finally, people listened. And now today, instead of antagonist and acid suppressants, you get antibiotics for acne. But that's another digression. As it turns out, this H. pylori is also associated with skin conditions. H. pylori thrives in conditions of low stomach acid. This is very important. A lot of people are making low stomach have what's called achlor or hypochlorhydria, low stomach acid issues, even though antacids are one of the best-selling over-the-counter drugs that you could buy or that are available. I used to work in nursing homes as a pharmacist, and almost everybody in the nursing home was on antibiotics. It turns out, or antacids. As it turns out, low stomach acid is a much more significant problem than too much stomach acid. We can get into why people have GERD or reflux disease on another video, but it's not because you're making too much stomach acid. GERD or reflux is a sphincter problem, and that is the sphincter that connects the esophagus to the stomach becomes loose and flabby. Again, digression. We can get into that on another show. But for today, what I want to point out is this H. pylori bacteria, which thrives under conditions of low stomach acid, is indeed linked to rosacea. And this is why antibiotics can sometimes work for rosacea patients, but it's probably a much more functional health strategy or protocol to eliminate H. pylori by acidifying the contents of the stomach and controlling for dysbiosis at the level of the intestine, which is what we talked about previously. Long story short, again, we see that rosacea on the skin, redness on the skin, is linked to the digestive system, either through dysbiosis, disturbances in gut bacteria, or low stomach acid. Next slide. Reinforcing this is from Rosacea Review. Common acid suppressants may increase risk of rosacea. Again, suppressing acid can increase the risk of rosacea. This was a study that was done from South Korea. They found that when you use these so-called PPIs, like proton pump inhibitors, like Nexium, for example, and also histamine antagonists, like the aforementioned Tagamet and Zantac, which are, quote, widely used therapies for treatments of acid-related gastrointestinal diseases, such as peptic ulcers. They still use them, are more prone or at increased risk for rosacea. Again, showing you the link between acid and acid suppression and the skin condition called rosacea. Next slide. It turns out that there's a relationship between insulin resistance and metabolic syndrome and rosacea. You can see how these underlying health challenges are the cause of skin problems that we assume are just topical. And so if you think your condition is topical just because you see it on your skin, of course, you're going to try to use all kinds of creams and lotions. And this is what really bugs me. And this is why I want to talk about this. There are companies that talk about how their topical products will address the rosacea. Now, there are some topical things you could do to improve the symptoms of rosacea, for sure. But if you want to eliminate rosacea, you've got to get into the internal milieu, the system, first with the digestive tract, and here by controlling for metabolic syndrome. This is from the European Journal of Dermatology. Quote, rosacea. They did a study comparing a rosacea group to a non-rosacea group. The rosacea group had significantly higher fasting blood glucose, total cholesterol, and systolic and diastolic blood pressure levels, all markers of metabolic syndrome, which itself is a marker of dysglycemia. Finally, our findings suggest that there's a relationship between rosacea and insulin resistance. No surprise. Next slide. Next slide. The stress management can play a key role in rosacea control. People who have rosacea, stress triggers flare-ups and their symptoms. in a National Rosacea Society survey of rosacea patients. Emotional stress was one of the most commonly cited triggers for rosacea. We know, of course, stress management or stress issues are adrenal health issues. I'm going somewhere here, folks. Next slide. New study shows heat increases nerve activity. Individuals with rosacea produce greater nerve and blood flow and sweating response than people without the disorder. This uncovers a role for sympathetic nervous system, their fight or flight nervous system, activity and other key involuntary functions such as heart rate and digestion and breathing and perspiration, all of which are controlled by fight or flight, also linked to the stress response, which shows up as rosacea. Quote, heat and stress have long been recognized as rosacea triggers, according to Dr. Tad Wilson, Associate Professor of Physiology at Ohio University. You see where we're going here. We got digestive function, we got insulin resistance, metabolic syndrome, and then we've got stress. Next slide. And finally, we've got the thyroid. Assessment of thyroid disorders in patients with rosacea. The frequency of autoimmune diseases and thyroid cancer. Hashimoto's thyroiditis, which is the #1 cause of hypothyroidism, is an autoimmune disease. The frequency of autoimmune diseases and thyroid cancer has been increasingly reported in association with rosacea, and that's especially true among people between ages of 40 and 49. And there's a parallel with hypothyroidism frequency in the study. Rosacea has been associated with autoimmune diseases like thyroid, including thyroid disease, as well as thyroid cancer. In the study, the frequency of hypothyroidism was significantly increased in rosacea patients. What do we got here? We got the triangle of disease. You got your digestive health issues, you got your IR, metabolic syndrome, or insulin resistance issues, and you've got your adrenal thyroid complex. Folks, it's always there. You've got the triangle of disease under any chronic condition. In this case, the dermatological condition called rosacea. Why is this important? Because when we see something on the skin, we immediately think skin. We immediately think, I got to address the skin. It doesn't work. You may be able to get some symptomatic relief, which is not a bad thing. And there are, as we'll see in a second here, some things you could do topically to improve the appearance of rosacea. But you have an immune, with rosacea, you have an immune problem, a vasodilatory or blood vessels opening problem, if you will. And all of that implicates the triangle of disease. And until you get to the digestive system by doing all your food stuff, food diary, eliminate problem foods. It's really easy with rosacea patients, by the way, to do a food diary because they get real-time results because they'll flush sometimes within 20 minutes, but certainly within an hour or so, a rosacea patient will respond, or maybe 2 hours, a rosacea patient will respond to food. So rosacea gives you real-time information as to the impact of specific foods on this immune response. And so food diary tends to be easier for a rosacea patient to do, and conclusions are easier to be drawn by rosacea patients because they get real quick information, real-time information. So food diary, eliminate problem foods. Of course, dysbiosis or messed up gut bacteria has to be addressed, probiotic supplements, fiber, a whole bunch of things that you can do there. Then you have to work on the blood sugar system, second point on the triangle of disease. And that's, of course, using supplements like the longevity sweeties or B-complex and niacin and sulfur and selenium. There's a whole bunch of blood sugar nutrients you could use, eating less sugar, of course, going ketogenic. And then the third point in the triangle of disease is the adrenal thyroid complex. That's a little bit trickier because the adrenals and the thyroid are going to be responsive to the digestive system and the blood sugar system, but still relaxation response strategies, yoga, meditation, hot tubs and warm water, psychological strategies like mindfulness, for example, those can all have a beneficial effect on cortisol, stress hormone, and on adrenal health. And then working on the thyroid, while you can't do that directly, you can certainly do it by working on the adrenal glands as well as the blood sugar system and the digestive system. So it always comes back to the triangle, always. And the beauty of this model is not only do you help with your rosacea, but you're going to reduce your risk of cancer and heart disease and autoimmune problems. And you're going to be increasing your longevity and just improving your quality of life, generally speaking. Always comes back to the triangle. So yes, it's true. You do want to work internally for these conditions, but as shown up in the last slide, there's a couple things that you can do topically to improve the appearance of rosacea. This is from the Journal of the American Academy of Dermatology. Complete resolution. Well, what they did was they used laser first, and then they used salicylic acid second on a group of rosacea patients, 10 rosacea patients. Interestingly, 9 females and 1 male. As it turns out, rosacea is much more of a female health issue than a male issue. And we do find this with immune-related problems, that women are more predisposed to immune issues than men. And the thinking is that testosterone, from an evolutionary biology perspective, testosterone and male energy was associated with a suppressed immunity or lower immunity, or less, let's say, less sensitive immunity, because men were out in the wild hunting. This is the theory anyway. Women were home. So it was more important that men didn't have immune reactions because they were subject to a lot of immune attack from the hunting. This is the theory, from the hunting process. So testosterone doesn't have the same kind of immune stimulating activity that estrogen does. And this is why chronic degenerative disease is in many ways a female health issue, much more than it is a male issue. Of course, men do get chronic degenerative diseases too, because they're making estrogen also. But we know estrogen will predispose you to inflammation and immune activation. So in any case, complete resolution of the remaining, after the laser was used, of remaining inflammatory lesions and improvement of redness was obtained in all patients. Salicylic acid penetrated more deeply in the areas of inflammation. In other words, salicylic acid was specific for the inflammatory areas, which is kind of interesting. And I think this is important because when you have rosacea, you may think, oh, I don't want to use stimulating ingredients. And it's true. If your skin is in the angry stage, you just ate, something, peppers or something that stimulated, chocolate or whatever, that stimulated your rosacea lesions, you probably wouldn't want to use a salicylic acid peel right at that point. But if your skin is not in an active rosacea state, salicylic acid can improve certain signs of rosacea. Likewise, retinol. I've seen some very good results with low dose retinol, low concentration retinol used on a regular basis as a way of topically improving rosacea-prone skin. Low concentration. I wouldn't use 5% or 1%. At Truth, I've got some pretty high concentration retinol formulations. I would say more like a 0.3% if you're going to use my Truth treatments, like my dermal defense. And we do have some products that will help, topical products that will help with rosacea skin. But for the most part, when you're dealing with rosacea, if you truly want to address the condition, triangle of disease, food, digestion, blood sugar, and then calm the body down. That will help the thyroid, and then the rosacea or the immune response will take care of itself. Pretty much guaranteed. Pretty much, I'm talking about a guarantee here. If you do this right, you never have to have rosacea again. Now, I do know people with rosacea who know good and well that when they eat certain foods, they're going to get their face is going to get red, but they like the foods, and so they deal with it. But if you really want to take care of the condition, there are strategies largely around food and digestion, but also blood sugar, as well as mindfulness and calming strategies that you can use to naturally, without drugs, eliminate rosacea so that you never have it ever again.
Yes, it's I've got some friends with some serious rosacea.
It's more of cosmetically, it's a bit just. Are you? I can't tell if you're talking to me here or not. Liam?
Yes. Can you hear me? Can you hear me? Can you hear me?
For some reason. Yeah, you're out of sync. You're
sync.
talking. Your lips are moving, and then the words follow. Or in any case, I know quite a few people. It's not really a disease. It gets treated as a disease. It's more of a response, an immune response, than it is a disease. But if you do have an activated immune system, there may be other health issues that that are developing that you're not addressing. And by taking care of your rosacea, you may be able to reduce your risks of immune health challenges to follow. And so you don't necessarily want to only think of it as cosmetic, but more like a red flag or a metric, a sign that something's going wrong inside the body that may progress. So you want to address rosacea not only because of the cosmetic reasons, but just to keep the biochemistry in a state where it's not becoming progressively more deteriorated, leading to other health challenges.
And
TrueTreatments.com. Yeah,
Ben's
Truth Treatments
website,
is, I started
Truth
Truth because I felt like
Treatments.
skincare was stuck in this old model. It wasn't working. And I knew why it wasn't working. And I knew it wasn't working because I kept hearing from my patients that nothing's helping their skin, nothing's helping their acne or their rosacea or their psoriasis or their dry skin or whatever it is. And I realized the reason it wasn't helping is because the products, number one, are antiquated. The formulations are antiquated. Even if it's a brand new product, it's based on antiquated formulation technology that doesn't leverage the power of a skincare product. Skincare product potentially can be medicine, and that's what I always felt like skincare should be, because the criteria for medicine is that you want the darn stuff to work. That's how the criteria for the value of a particular medication is, does it work? Not what it smells like or what it feels like or what it looks like or what the package looks like or who's the influencer who endorsed it. The criteria for an antihypertensive or birth control pill or antibiotic is, does the darn stuff work? The criteria you use to assess its value. I felt like that criteria should be applied to skincare as well. Does the stuff heal my skin? Does it make my skin look better? Is it creating a change in my skin? And what I discovered was the way to create changes in the skin is to completely redesign how a skincare product is put together. And that's what Truth Treatments are. It is a complete rethinking of the skincare formulation, which is why you only use 1 or 2 drops of Truth Transdermal C Serum or a tiny, we have to actually give you a little tiny spoon, because
Really?
in order for you to see the dose is ridiculously small. And the biggest mistake people make when they use my Truth Transdermal C Balm or Truth Retinol Gels, they use too much because we're used to this. Let me tell you something. The silliest thing you could do to your face, or your skin, on your body, or wherever you're putting your skincare product, is just slather and rub. With my Truth Treatments, because they're so concentrated, 100% active and functional. That means there's no water, no silicone, no vegetable oils, no fillers, no preservatives, no waxes. It's all active and functional ingredients. You use 1 or 2 drops and you massage it in. 1 or 2 drops, massage it in. That gives you value because your Truth Treatments are going to last you forever. Not forever, but they'll last you a really long time. And it also means, very importantly, you're not forcing your skin to have to interact with a whole bunch of product. You don't want, that's not a good thing for your skin, to smear a bunch of stuff on, particularly stuff that you don't even know what it is. There are some skincare products that have 80 different ingredients in them. Not good.
Yeah,
Not good.
Yeah.
You don't want to smear 80 different ingredients on your face. With my Truth Treatments, you don't have to do that. 1 or 2 drops. Most of the formulations have 5 or 10 ingredients. They're all nutrient-based or analogous to something that's already in your skin. They're friendly to your skin, and they're designed to penetrate so you don't feel a bunch of product on your surface of your skin, and you shouldn't, because you don't want to cover up the skin. You don't want to, what we say in the business, occlude the skin. So anyway, truthtreatments.com. And I've been doing this thing with skincare for many, many, many years, almost 40
And
years.
we've got a related question from
Brenda.
Any recommendations for hypothyroidism?
We have so few listeners that I know every one of our listeners. I think Brenda's new. Hi, Brenda. I'll answer your question if you answer mine. Where are you calling from, and how'd you hear about us? And I will tell you, I'll answer your question, because we do talk about hypothyroidism a lot. It's a major topic. And we could talk about the triangle. But Brenda, send a note back. Tell me where you're calling from, or where you're writing from. In the meantime, I'll answer your question. So hypothyroidism and losing weight is a big issue, especially for women, because it involves the adrenals and it involves the hormone estrogen. Hypothyroidism, as I was saying earlier, how chronic degenerative disease is largely a female issue, it's true about hypothyroidism as well. Most hypothyroid patients are women. And this has to do with estrogen, as we talked about. And it's especially problematic post-menopause. Happens throughout, a woman's life, it can happen. But post-menopause, the thyroid really, it goes to sleep. And that's because of changes in estrogen and where estrogen's made. Usually, premenopausal estrogen's made in the ovaries, the reproductive glands. Postmenopausal, it shifts over to the adrenal glands. So if you're under a lot of duress, this can really burden the adrenals. If you're under psychological duress or inflammatory duress, or the first 2 points in the triangle of disease, digestive issues or blood sugar issues, this can put a major stress on the adrenals, which in turn will create a stressor on the thyroid. There's an important relationship between the adrenals and the thyroid. There's also an important relationship between the digestive system and the thyroid. And in fact, hypothyroidism is an autoimmune disease, mostly, not always, but mostly. And autoimmune Hashimoto's, or what's called Hashimoto's, is always backtracked to the intestine. We talked earlier about dysbiosis. And then also the thyroid regulates the intestine. So it goes both ways. The intestine has an impact on the thyroid, and the thyroid has an impact on the intestine, which of course means the intestine will go back up to the thyroid, and you end up with this whole circle where one affects the other, downward circle. So by working on intestinal health, you can stop that. And that's so important for the Hashimoto's patient, or any autoimmune disease, but particularly for the Hashimoto's patient because of the thyroid involvement. And then the whole insulin resistance thing. So what we're talking about here when you have weight issues and thyroid issues is not a pill. This is what they have us thinking. They give you Synthroid, or they give you Cytomel. You know, every year the best-selling drug in America, or among the top 2 or 3 best-selling drugs in America, is thyroid medicine. It's extreme. Hypothyroidism is extremely common. And the only thing that they have for it is to give you thyroid hormone. Nobody ever thinks to address the gland. Unfortunately, to address the gland, you've got to make some changes in how you live your life, the kind of foods you eat, particularly sugary foods. You have to go ketogenic. You've got to go calorie restriction, no processed food. You got to support digestive health, everything you can do for the digestive system and the blood sugar system. As far as the adrenals go, stand down, relax, yoga, meditation, warm water, massage, psychological techniques like mindfulness and gratitude and getting enough sleep. All of these are very important for adrenal health. Between those 3 steps, digestive health, working on insulin resistance and what they call metabolic syndrome, relaxation strategies, pretty much every single health challenge you can name will at least begin to resolve, especially if you are adding in a nutritional supplement program, which everybody should be on, a good nutritional supplement program. Now, of course, everybody knows about iodine, but it's not like iodine is a cure for hypothyroidism either. Iodine is important for thyroid hormone, but the gland it helps the gland a little bit because iodine is important for all the glands. It has a very important role to play in cellular energy, and the glands are very energetic. They're always in action. So there'll be some benefits for the thyroid gland as well, but you still got to work on the first 2 points of the triangle of disease. And it can be done. I've seen it done a lot. And also, not only can it be done, it has to be done, because hypothyroidism is the jumping off point to cancer, to heart disease, to autoimmune diseases of all kinds, to movement disorders, to brain issues, including dementia. Everything that sucks about life in terms of health comes from hypothyroidism. Dr. Broda Barnes wrote a book in the, I think, late 70s or early 1980s called Hypothyroidism, the Unsuspected Illness. And in it, he makes a very compelling case for what I'm telling you now, how what we call heart disease really is a form of hypothyroidism. And he names all these diseases. It's not so much that all these diseases are really forms of hypothyroidism as much as it's this hypothyroid that suppresses cellular energy, which is what leads to disease. So really, the thyroid is critical to work on. Critical. And because hypothyroidism is so common, it's a really significant issue, particularly for postmenopausal women. I hope I answered your question, Brenda. I know that's a lot of stuff, and you can always send us an email if you got more questions. Send ben@truthtreatmentsystems.com, and put your phone number in there, and I'll give you a call. Okay, Liam, you're the man.
Awesome. You're the man, Ben. Truthtreatment.com. Check out the website.
Thanks for the plug. Appreciate that.
That was
all right.
That was awesome, Ben. All right, everybody. Thanks for watching.
Bye.
See you next time. Bye-bye.